The idea that we're going to have pain just because we're aging is not an accurate idea.
Pain isn't just about one joint, one injury, or one bad day. It's your body asking for attention, and the right guidance can change everything. Welcome to the Optimal Health Guide. I'm Michael. I'm the host here, and I am here with Josh Vance. Josh, great to see you again for another call.
Glad to be here. This will be interesting today.
Yeah, I think so. It's going to be pretty fun. We've been really trying to lay a foundation of care and services and methodology that you play out. And I think today, for the first time, we're going to start diving into a little bit more of a specific demographic. And we're going to be able to talk a little bit about one of the ebook resources that you've created as well. So I'm looking forward to giving a little bit more airtime to that. What I'm really hoping today, too, is that we might even be able to challenge some of the ideas about aging and how that automatically means you're going to be dealing with chronic pain and declining mobility. So we'll have our ears tuned to be able to listen and learn all along the way. So let me just dive in, Josh. Why is it that you think so many people assume that aches and stiffness are just part of getting older?
I've been asked that a lot of times. People come in and they say, well, I'm just getting older. So they have that assumption
Yeah.
that as we age, we should have pain, impairment in mobility and all that sort of stuff. But I think that it's normal to have pain, which isn't true, but it's very common. The idea of aging, they hear maybe their grandparents, or maybe they see, have this mental image of their grandparents when they were a kid and maybe limping or my arthritic fingers or hip or back. And so they kind of just have that idea that as we age, along with this, there comes pain and there's nothing we can do about it. Well, a pain that we shouldn't have as we age. And with anything that ages, maintenance is going to be required. And this could be your car, certainly your body too. We have to make sure we're doing things to keep everything in order and working optimally. So that means it takes an investment. It might be an investment of resources or time. It might be an investment of a little sweat equity.
Yeah,
Whatever it may
absolutely.
be, as we're aging, there are things that we need to do to help handle these potential aches and stiffness, which are not normal necessarily.
Yeah.
Maybe not 100% at the time. There's a small percentage where, because of some factors, which maybe we touch on later, we do have some stiffness or some pain. But even still
Yeah.
with that, there's things that can be done to handle that. But the idea that we're going to have pain just because we're aging is not an accurate idea.
Yeah.
So sometimes it takes more investment than other times during our lifetime. And certainly as we age, there's going to be more investment necessary. But it's always
Yeah.
easier to prevent a problem than trying to fix it. So the more
Yeah.
we do
I hear
prevent
you.
it, the more we do put our time into, or our energy resources, whatever it is, into handling things, the better off we're going to be on the other end of it.
Yeah. What you've already hinted at that there are some preventative measures that people can take. What do you think would be the top 2 to 3 specific recommendations that you would typically give to somebody sitting in front of you, kind of voicing this same conversation? Hey, Josh, I'm noticing this. What would you tell them even preventatively that would be a good means of going at this?
I think as a general statement, I would probably say maintain good strength. Strength goes a
Hmm.
long ways in handling a variety of different issues, be it just like knee pain because we're weak, or back pain because we've got bad body mechanics and a bunch of other things, but just staying strong can help. I think that's one thing. I think another thing is stay moving. Don't stop. The
Mm,
more we do sit
yeah.
down, the weaker we get, the more postural issues we see, just the
Hmm.
less cardiovascular exercise we get. So just being active, and that may just be walking for somebody. It might be doing a marathon for somebody else. But
Sure.
we got to stay active. We got to stay moving. Don't stop moving, or we're going to be stuck.
Yeah. That's great. Love it. What actually does happen in the body during that 40 to 60 age range, and specifically with women?
Well, there's a lot of different changes that happen, and particularly with women. This one's definitely a change that women deal with. It's that decrease in estrogens that happens with menopause. Estrogen helps with immune function. All right. So With decreased immune function, we are more likely to have inflammation occur. This can affect your body's ability to handle those inflammatory reactions that
Mm,
occur. Maybe it wasn't a big problem, 10 years ago, but now it
sure.
is. And so that inflammatory reaction is occurring more frequently in your body. Another factor is foods. There are some foods that are known to be inflammatory and can
Mm,
promote further inflammation within the body. So
hmm.
nutrition is also a very important aspect to consider and making sure that we're being wise about that.
Yeah.
But all this increased inflammation can then lead to different pain and different structures.
Yeah.
I think another change is weight gain as we age. Our metabolism decreases, things change a little bit. And if you think about just a 2 to 3 pound gain per year over a
Mm,
decade, that's 20 to 30 pounds. So
yeah. Big
that
difference.
can easily continue into maybe our fifth or sixth decade or seventh or whatever. And so that easily can become a problem that impacts our joint health, it impacts our
Hmm.
aerobic health, our cardiovascular health, a lot of different things that are then potentially affected. And just, our ability to get up out of bed. If we're a little weak and we're a little heavy, sometimes just getting out of the bed. I've had a lot of people tell me I feel like a beached whale.
Yeah.
So, that's another thing that can happen. So nutrition is certainly a component of that.
Yeah.
Another body change is postural.
Mm,
From years of bad posture, potentially, it compounds itself. And then what we have happening is structural changes because of those postural habits that could limit range of motion. It could cause decreased mobility in the joints and tight
hmm.
muscles, certainly, weakness in some muscles, as well as overuse in other muscles that should be using, but
Yeah.
they're weak. So that has a role. You're going to feel it if you're not paying attention to it. So that posture has an impact over time, especially that chronic posture. If you're
Hmm.
doing a lot of things over a desk or seated. There
Yeah.
are every position has pros and cons to it. Every job has pros and cons to it. But,
Mm,
if you're a person that sits a lot, well, you're going to have certain areas are going to tend to be tighter and weaker. So making sure we're combating that is a super, super important thing. And that we have to be aware of that as our bodies do change over the decades.
that's great. Okay, well, you've already hit on that in a preventative manner. Strength could be really advantageous. Just maintaining activity and movement can be really, really helpful. Get out there and move, whatever that looks like. And, I would imagine what desires you have, because some people, I don't want to go out and run, but other people, they really light up at the idea of
Mhm.
running. So do something to keep yourself active. You did mention nutrition playing a big part. Are there any categories of food or types of food that you say, hey, you should really consider staying away from these in the 40 to 60s? And then others that, hey, you should really think about adding these or making sure that you emphasize these?
Well, as far as I wouldn't just limit it to 40s and 60s, but the
Okay.
higher the processed foods, the more other stuff that goes into it, the less healthy it really is for us. There's a lot of
Yeah.
processed meats and other things that are well known to cause problems and disease. And
Yeah.
and I mean, disease in America, obesity is huge, and from there we go into high blood pressure, high cholesterol,
Yeah.
diabetes, all those sorts of things that become a snowball. Much of that is very much manageable with enough understanding and paying attention to it. So, limiting those highly processed things
Yeah.
and, the simple sugars too, in the sense of highly processed carbohydrates. A
Hmm.
lot of the snacky stuff, they're really
Yeah.
should be limited. Absolutely. As far as what to eat, I would highly recommend a lot of vegetables, fruits,
Hmm.
whole grains, things like that are
Yeah.
going to give your body the micronutrients being vitamins and minerals,
Hmm.
without impacting potentially your weight as much, since they tend to be a whole lot lower in caloric intake
Yeah.
than many other foods that we might be eating.
That's great. And you brought up nutrition specifically when you were talking about lower estrogen for women. during this particular kind of phase of life. So it does sound like women have a compounded set of circumstances that they're facing. Any other practical advice that you might speak to a woman? You've kind of pointed out nutrition, you've already hit upon, strength and mobility. Anything else that you would drill down into, especially in light of what women are facing?
I would say if there is an underlying inflammatory conditioning, making sure they're being proactive
Mm,
to prevent it as their immunity is impacted to some degree,
yeah,
is a real important thing to be paying attention to. If it does become an inflammatory issue, then handling it sooner rather than later
yeah.
would be ideal.
And then forgive my ignorance here. I mean, I hear what you're saying, and I know inflammatory, so I know that's bad. But get a little bit more practical for me, especially like what would that actually look like?
Okay. Sometimes it's just pain. It could
Yeah.
also be in the sense of we get some inflammation going on in different structures. So we might get
Hmm.
some swelling in our knees, perhaps, or maybe some shoulder pain, some tendon
Hmm.
inflammation. We may strain something and not be able to bounce back as quickly because of that underlying inflammatory process that's already going on. We don't
Yeah.
have as good of ability to handle that with the decreased immunity, and so now we're a little bit more prone to that strain becoming more problematic, limiting an ability to stand up, function, do whatever, and
Yeah.
so it just gets a little more irritated. So
Okay.
doing some things to handle those issues.
Yeah. Okay, that's really helpful. What I'm hearing then in a big picture is that there are symptoms and things that people are going to experience as they age, but it is pretty easy for them to compound into almost turn into negative motivators. Well, I'll just sit here. Well, this hurts, so I'm not going to. I really appreciate again the thread you're weaving here about like all these preventative things really do make a big difference.
Yeah, I think you're right. It is easy. When we hurt, I don't want to move. I don't want to do this.
Yeah.
I don't want to go walk. I don't want to bike. I don't want to do whatever it is. I don't want to do some exercises because I'm
Hmm.
afraid it's going to hurt. So then that fear plays a big role in getting better too.
Yeah. Well, last question that I've got, at least in big one, I might pull a couple of threads on the other side of what you say here, but we titled the ebook that you produced Graceful Aging. And I'd love for you to just to kind of maybe draw a picture for us. What does graceful aging realistically look like when people take care of their bodies in these ways you're talking about?
I think it's being able to live like we're meant to be able to live. And there's a lot of different components to that. So, let's talk about those. One
Yeah.
component is flexibility. So
Hmm.
we want to be able to maintain flexibility so that we're able to easily move, so that we have full motion in our joints, that we have long muscles that are able to move the way they're supposed to. I mean, most of us realistically, once we're done in PE, we stop stretching.
Yeah. Yeah.
If you're stretching beyond that, well, great job, but most of us don't.
Nice. Good.
So, that flexibility is important. And with people doing different kinds of jobs, their job is going to impact their flexibility. If a
Hmm.
person's an accountant and they're sitting all day long, well, not even just an accountant, but anybody that's just sitting, we're going to
Sure.
get tight in the front of the hips. They're going to tend to have more of a head forward position, shoulders
Hmm.
rounded, kind of bent through the upper back. And so we get physiologically tight in those areas. There's
Hmm.
other things that happen too, but we get tight in there. And so if we aren't doing things to change that, that's going to be a problem. So I think another thing that it looks like is,
Hmm.
living without pain so we can enjoy work. We can enjoy
Yep.
family and friends
Yeah.
and doing our recreational things. I've seen plenty of people that are afraid. They're in therapy and they're afraid, well, I have this trip planned. Am I going to be able to go out and do it? Absolutely, we want that.
Yeah.
Gardening, whatever it is, we
I
want
love
you
it.
to be able to do it.
Yeah.
And it's the way we're made to be. We should be able to do these things that we're supposed to be able
Yeah.
to enjoy and live life to the full. Another way is free of chronic inflammation, like we talked about, managing
Hmm.
stress. Stress causes cortisol, which is a hormone. That
Hmm.
also can have a negative effect. And then, of course, the nutrition. So all that, again, compounds to promote more inflammation. So we got to be able to manage that inflammation. That's part of taking care of ourselves, getting the sleep, doing
Yeah.
some things that help us with stress. Maybe it's exercise, maybe it's, being in a quiet place, maybe it's reading a book,
Yeah.
managing stress, going outside, just enjoying looking at some trees, just
Mm.
whatever it is, we need to be free of that chronic inflammation.
That's good.
Maintaining a healthy body weight, that's a
Mm,
big one. The
mhm.
more body weight, the more stress to our joints. That can cause unnecessary wear and tear into our joints, which then kind of promotes this whole cycle of breakdown, which can lead to pain, which can lead to potential surgeries and things like that.
Yeah,
So, maintaining a healthy body weight is important, and nutrition has a huge role in that. Maintaining an active lifestyle, which certainly can vary from one person to another, like you were mentioning. Maybe I
yeah,
like biking and you like walking or jogging,
sure.
whatever that is, something to keep ourselves moving, motivated, enjoying life, not
Yeah,
bored. That's graceful aging. That's how we're going to age and be able to take
that's
care of our
great.
grandkids and be active, whatever it is we're wanting to do. But it all works together.
We oftentimes are really easy on ourselves. But what I really like that you did, even though these things, we can tick off this list, I like the motivation that you're putting out here. Hey, you should be walking with your grandkids. You should go on that trip. You should garden. I like the visual that you're portraying that again is going to be hidden in the heart of every individual. But like you should be doing things. You should be living this optimal life that you long to be living. And I think what that does for me is puts this goal in front of me that helps me to go, yeah, Josh, I don't really want to do these things, but I hear you. If I do these things, I can get to this that I want to be able to actually do. Any comment or thought that you want to add into that?
Yeah, a purpose. We all have to have purpose,
Yeah.
and our purpose changes over the years. It may be, you're in raising young kids, or maybe
Yes.
you're in the grandparents, or some empty nesters, or whatever it is. But we have to have purpose, and our purpose may slightly change depending on what we're doing and where we're
Yeah.
at in the cycle of life. But that purpose we have to have, and we have to think about our purpose and do things in order
That's
to
good.
keep our focus on what we're trying to achieve with that
Yeah.
purpose. And living healthy is part of what's going to be able to help a person maintain their purpose and do what it is they're trying to achieve.
Yeah, that's great. Well, let me just open it up for one final thought. Anything else that you would want to say to somebody who's, again, facing this question? Gosh, I just keep feeling like this is just the way that it is as I age.
Look for some encouragement. Find somebody that's an
Hmm.
encouraging person.
Ooh, that's
Talk to
good.
them a little bit.
Yeah.
Let us encourage you. If you have
Yeah.
an issue, talk to me. I would love to hear what it is, and maybe there's something that can be done to alleviate that, or at least to improve on it, so that we
Yeah.
can help you move towards what your purpose is. And if you don't have a purpose, well, we got to fix that too, so that you can
I love it.
find those things that you're wanting to do and start moving towards that.
That's great. Well, great job giving us a vision of the optimal life and optimal health that you're coaching people toward. Thanks for the input and the feedback that you provided. If you're listening to this conversation and this has resonated with you, like I mentioned before, Josh has written more about this idea of graceful aging and optimal health. It walks through, many of the lifestyle and movement factors that help people, specifically women, to stay active and mobile as they get older. So we'll put links for that for you to be able to follow up and see that resource. Thanks everybody for listening in today.